I'm Dr. Sue Ettinger. I'm a medical oncologist in New York. I work for VCA Animal Specialty Center, and I'm going to be telling you a little bit about my new program that I'm working on called See Something, Do Something. So See Something, Do Something. Oh, why did it do that? We'll try that one more time. If not, we'll just jump in. So I just got asked to do this talk about 2 weeks ago. I feel a little bit like an understudy for Broadway. So I'm really excited to tell you about this new program. And hopefully you're going to be as excited, because this is what gets me going every day, and this is what makes me passionate. I didn't really know much about an Ignite talk, so I do what we all do, and I Googled. And one of the suggestions was talk about what you love, talk about what you hate, and what you're good at. And that's what I'm going to attempt to do in the next, 4.5 minutes. What do I love? I love my family. I have 2 wonderful boys and a great husband. I love black Labradors. That's my Matilda. I love my morning cup of coffee. I love sushi, and I love beets. Not those 3 things together. What I also love is I love being an oncologist. And I know that is really bizarre to most people, because they think it's about death. They think it's about being sick. And they think this is what I do to my patients, that I make them sick, and it's depressing. But the truth is, 80% of dogs and cats going through chemotherapy don't get sick. And it's all about quality of life and extending the time that they have and making their time on treatment as good as their time off treatment. The bottom picture is my boss's dog. You can't tell which one is going through chemotherapy for lymphoma. It's Roxy on the left. Up top is Bella. She had just finished radiation therapy for a nasal tumor and was going through chemotherapy and still doing agility. This is what I hate. This is what depresses me in my job. These are dogs and cats with tumors. Had I seen earlier, we could have done surgery, not me, but a surgeon or a general practitioner, and these tumors could have been cured. These are predominantly mast cell tumors and soft tissue sarcomas. The bottom picture was Joey. This dog had a 12.5-pound, 26-centimeter, low-grade soft tissue sarcoma. He unfortunately died under surgery, and it really depressed me, because I knew had we seen this sooner, we could have done something better. This is Smokey. This wonderful pitty was my nurse's dog. He came in pretty periodically. Over 2 years that I had known her, I had aspirated many lipomas on him. She brought him in another day, and I was just supposed to aspirate another lipoma. I stuck a needle in it, and I got back blood. The aspirate came back sarcoma, preoperative biopsy, low-grade soft tissue sarcoma like Joey. He needed a big surgery, 13 centimeters. A surgeon had to move a flap. It broke down. There was drains. It was messy. And I thought to myself, how did I do this? This dog is under my nose. How did I guide Amanda wrong? I'm a medical oncologist. I see this dog all the time. And the truth is, I got complacent. We thought it was going to be another benign lipoma, and it wasn't. So I went back to my books. Crazy amount of training, right? And where in my oncology books did it tell me what to do? I must have missed it or forgot it. And the current guidelines, if a mass is growing, changing in size or appearance, then you should work it up. But the problem is we're missing tumors that could be cured, and we must do better. So I talked to some of my colleagues. I sent out emails, and I convinced VCA. I begged them, please let me do this program. I want to call it See Something, Do Something. The idea is if a dog or cat has a mass that is the size of a pea and has been there for a month, we must aspirate it. I'm a board-certified cancer specialist. I can't look at a mass and know if it's benign. Clearly, we thought with Smokey it was going to be a benign lipoma, but we can't. And what's surprising to most people is that the average pea, which is 1 centimeter, is half the size of a penny. We have to find these masses earlier. We can do so much better for our patients if we can find these tumors. 20 to 40% are going to be malignant. Many of them are going to be benign, but even those malignant ones we can cure with surgery alone. This is what I'm good at. I'm good at aspirating. Anybody can be good at aspirates. It's not technically hard. You don't need a lot of equipment. My husband has fancy ultrasounds and scopes. He does cystoscopy, bronchoscopy, transtracheal washes. This is pretty much what I do. I stick needles in masses. You need needles, you need syringes, you need some slides. If you have a microscope, that's great. But I'm advocating, unless it's fat, you send it to the cytologist. So get those samples out to the lab. I'm a geek. I love cytology. I love lymphoma. In the middle, we have carcinoma. On the bottom, we have soft tissue sarcomas. And I love that. But the cool thing about this program is Dr. Google can't do it for our clients. Only we can do it. Only we can stick the needles in, and early detection will save lives. Real quickly, I told you I love black Labradors. This is Rufus. His local vet found this 2-centimeter mass on the inner thigh. He sent it to us to work it up and send it to surgery because it was in the inguinal region. On the lateral leg, we found this other little mass. I stuck a needle in it. It was another mast cell tumor. Our surgeon did both the surgeries, the inguinal thigh. We measured. We got 3-centimeter margins for both the tumors. They both came back low-grade mast cell tumors, c-KIT negative, and that dog is essentially cured. We'll monitor him, but we found these early before they were big. So remember, why wait? Aspirate. Early detection will save lives. Size of a pea, 1 centimeter. Please aspirate them. Thank you.